and I am getting ready to have us live streaming on YouTube. So welcome. It's my honor and pleasure to introduce to you our co-chairs for today, and that is our director, Kimmy Watkins-Tart, our Alameda County Public Health Director, and our co-chair, Nestor Castillo. Our other co-chair, Greg, is out today. I believe he may join us or may not be able to join us for a little bit, but Greg is on vacation.
Maria, are we going to have a channel for interpreters?
Yes.
Okay.
Thank you. So next, I will share my screen to show today's accessibility options with you all. And if I could have one of our interpreters, please read the instructions.
Sí, por supuesto. La siguiente presentación tiene servicio de interpretación al español. It is in Spanish. Ah, ok. Sí. Para iniciar esa función, haga clic en el icono de interpretación. Es un globito que está en la parte baja de su pantalla. Seleccione español o inglés como desee para escuchar la interpretación. Como dice opcional, para escuchar solo el audio en español, haga clic sobre Mute Original Audio, que apague el audio original.
Thank you very much, Maria Robles. And so this presentation will be provided in Spanish simultaneous interpretation. In a few seconds, you will see the globe icon. So we're going to start that now. And I also want to let you know that we have American Sign Language interpretation today. And we are working on turning on our closed captioning function for today. So please bear with us and apologies for the delay in turning that on. But meanwhile, while we resolve those technical issues, I'm going to hand over the floor to our co-chair, Nestor.
Thank you, Maria. Welcome, everyone. I think we're actually going to turn to Director Kimmy Watkins-Tart so that she can give us a nice warm welcome, better than I can do, to this lovely virtual space. And so, Director Kimmy Watkins-Tart, the floor is yours.
Thank you, Nestor and Maria and everyone, and welcome. We have a few new members of our community advisory group here with us today. And I want to welcome Mildred Creer with Black Nurses Association. She's the chair of the Nursing and Community Education. Maria Costin, vice chair of the African American Wellness Project. And Keith Brown, president of the Oakland Education Association. And I wanted to start with those welcomes so that you could see who those individuals are, and we can do the round the room welcome, and we could also talk about really what we hope to accomplish in this space. Let me just say a little bit for new members. What the purpose of the group is, again, just to kind of reground us, and then we can do a round of introductions so that new members can know who the rest of the CAG members are. We established this space, I don't know how many months ago, but it's 14 meetings ago.
January,
thank you. To help guide the rollout of our COVID vaccine throughout Alameda County. And we recruited and engaged many, many members of our Alameda County community to help advise us in that effort. We are now at a stage of this group, the evolution of this group, or the maturation of this group, as well as in the pandemic, where we are broadening the scope of what we discuss in this space. And so we will be talking about all things COVID. And down the road, we will also begin talking about other health issues that are either impacted by or intersecting with COVID as well. We want to always bring forward to you information about what we're doing in the COVID operation. We want to get your input, your thoughts, and your guidance. And up till now, all of that has been wonderful. We have incorporated most, if not all, of your feedback and input. Much of how this meeting is structured is due to a lot of your input and your support and help. Also, a lot of the work that we're doing in the community in order to bring vaccine to the people of Alameda County has come from you. And so the Healthcare Services Agency and the Public Health Department really want to thank you for your continued participation. To our new members, we welcome you to this space, and please know that we are hoping that you will contribute to the well of ideas, of thoughts, feedback, input, questions, so that we can continue to improve our work in the community together. So let's go ahead and get started in terms of introductions. I can't quite see everybody. So what I'll do is, how do we do this? Nestor, how do you do this so smoothly? The intro.
I can jump in as well.
Okay.
Thank you. So yes, our co-chair, Greg Hodge, usually does this very smoothly. So I will invite everybody to please put your name in the chat and which organization you are a part of. And while I do that, or I invite you to do that, I'm going to put up the agenda for today so that I can help situate you into what we have for today. So you just heard our welcome from our director, Kimmy Watkins-Tart, and our co-chair, Nestor Castillo. Next on our agenda, we will have partner updates, then followed by county updates on the COVID epidemic, our COVID response, the DOOR project, and our coalition's request for proposals, RFP, and then we'll end with panelist comments and questions and answers. We invite panelists to please keep your microphone on mute when not speaking. And if you are speaking, to please speak slowly, because we have interpreters who are interpreting simultaneously, as well as our Spanish interpreters and American Sign Language interpreters, so it really helps them. And for attendees, please include questions in the chat and question and answer box so that we can make sure that we don't miss your questions. So we do want to keep this interactive and at the same time balance it with wanting to make sure we end on time at 7. So here's our next slide. So partner updates. Nestor, would you please facilitate this?
Yeah. Yes, of course, Maria. It would be nice to hear just quickly from our new members, though, just to hear their voices and have them introduce themselves. And since there aren't that many of them, I think it could go pretty quickly, starting with Mildred, if Mildred is here.
Yes, Mildred is on the phone. So Mildred, if you could hear us, we'll make sure that you are unmuted.
And we can return to Mildred also if we're having some technical difficulties. Why don't we return and go to Maria Costin?
Hello, everybody. I'm Maria Costin, and I'm a vice chair of the African American Wellness Project, which was founded by Dr. Michael Lenore almost 20 years ago. I've been on the board pretty much since the beginning. My background is in media. So at the time I was working at KBLX, a lot of you have probably heard the health tips that is still continued on. And I'm so happy that we can be a part because the COVID and getting the awareness out, we're looking at being a megaphone for the African-American community and health disparities. So any way that we can do to be a part of this organization and task force, we're very happy to be a part. So thank you for having us.
Well, thank you, Maria, for joining us and for taking time out of your day to be here. Next, we'll go to Keith Brown.
Good evening, everyone. My name is Keith Brown. I'm a newcomer middle school teacher in Oakland, and I'm also president of the Oakland Education Association, representing educators in the Oakland Unified School District. Today was our second day back to school, and our educators are happy to see and educate our students. And thank you for letting me in this space. This is very important work because we want to make sure that our kids and communities are safe and healthy. So appreciate being here.
Thank you, Keith. Thank you for being here. Let's see if we can get Mildred back to say a quick hello.
Hello, this is Mildred Creer with the Bay Area Black Nurses Association. Can you hear me?
Yes, we can hear you loud and clear.
Hi,
Okay.
Mildred.
Hi.
All right. Thank you so much to all, and welcome to all of our new members. Now, I think we'll have a chance to hear from all of the great work that has been taking place in our communities from our partners, from our various partners. So I'd like to just open up the space and invite anyone who wants to give us an update on the work that you all have been doing since we last met, which I think was a little while ago. Who would like to start off our partner updates? All right, Gabriela, I see your hand. Go for it.
Good evening, everybody. It's happy to be here with you all. I'm glad we're having these meetings. It's very important as we're seeing the surge in the numbers, continuing in our communities with Street Level Health Project in partnership with the Public Health Department and La Familia. We have continued to do our daily vaccines once a month. And actually, we just held our last one behind the Walgreens at East 22nd and Coolidge this past weekend. And we were happy to report that we were able to have 207 people come through this weekend, as well as provide hot meals, gift cards, backpacks for kids as they were getting ready to go to school and many other things. So we're really happy and grateful for this partnership. And I think one thing that we keep hearing from community members is that they really like this model of not having appointments, being able to show up when they can. The hours and the days work really great for the community that has been coming by, and just how friendly it is to just show up at the vaccine site and somebody being able to greet them in their language and in a culturally sensitive way. So I just wanted to give that small report back, and I don't know if Aaron from La Familia, you want to add to that as well.
Thank you, Gabriela. Always a pleasure to partner with both Public Health and, of course, Street Level. If you ever come down, or if you ever want to volunteer and be with us on the weekend, we definitely would invite you to do so. It's an experience, always eventful. And what I can say is that we're really looking at the highest quality of service and really how we operate from a street level perspective and just being mobile. It's different than a stationary site. And that's one thing that we've been able to see with our partners there in Fruitvale as we've been doing this. We've also been doing vaccines with some of our other partners in Oakland. And Gabi, thank you for reminding me as well. So we did provide vaccines just yesterday over at Homies Empowerment, which has been a great partnership as well in the Deep or Deep East Oakland, as we call it. And bringing it back down to South County, last week, We did vaccines at Tennyson High School, at Mount Eden High School, and at Hayward High School. So we did mobile clinics each day, throughout the week. And in addition to that, on the 31st of July, we did vaccinations with the South Hayward Youth and Family facility with our partners there. So that was really, really cool because a lot of people came and got vaccinated. And in addition to that, we also did do a food distribution and vaccination event during the same week. So it's been pretty busy, but great partners and extremely supportive. Gabi, I can't thank you enough. And Vasi, I don't know if you're here, but Maria, your team, it's extremely supportive for the nurses that have jumped in from public health as well to support with the clinical side, with the floaters that have helped, during the registration side. Just really appreciate that. Thank you.
Thank you, Gabriela, and for that nice handoff to Aaron as well. Thank you, Aaron, and thank you both for the great multifaceted work that you all are doing for the community. I see Michelle Smith-McDonald's hand is up, and then we will go to Mary Lou Breslin.
And Nestor, if I may interrupt, I also want to announce that Dr. Sherilyn Cook is in the room, and she's also a new member. And so I wanted to hand it over to Kimmy for a welcome. Also this new member.
Welcome, Dr. Cook from Sinclair Miller Medical Association. Do you want to say a couple of words before our two CAG members give their updates? You're on mute. Sorry about that. I'm Dr. Sherilyn Cook, and I'm an internist at actually for Kaiser, and I'm president of Sinclair Miller Medical Association, which is an organization of primarily, but not all, African-American physicians in the Bay Area and part of the National Medical Association. So I'm happy to be here. Thank you. Thank you. Pass it back to you, Nestor, to continue partner updates.
Thank you, Kimmy. We'll go to Michelle.
Good evening, everybody. So I'm with Alameda County Office of Education, and I'm sure we'll be talking about schools and youth a little later, but I wanted to just offer an overall schools update. I know it is early, but I have popped into the chat our composite school calendar just in case anybody wants to see it for their information. This week, we have a significant number of school openings. I know in the old days, we used to open after Labor Day, but it is the second week of August, and we have the following districts that have opened this week. We have Sunol Glen, we have Pleasanton, Piedmont, Oakland Unified, Newark, New Haven, Castro Valley. So those are all open this week. We have quite a few school districts opening again next week. So school is open. We are continuing to communicate directly with school leaders. We had 200 school leaders from across the county on our weekly call last week with Dr. Moss and the ACPHD staff. We do that call every week for our health leader or our school leaders. They are private, public, charter, all of our school leaders across the county. We've been convening them now. I believe we counted over 60 meetings so far in the last year and a half where we're putting them on the phone with the health officer every week. We are continuing to work on supporting districts that are looking to ramp up their testing. And we are continuing to help facilitate vaccine clinics, working obviously with the ACPHD folks, but also connecting some of our districts with local retailers to get vaccine clinics set up. And we've been strongly encouraging folks as they are doing their back to school orientations and their registrations to use those opportunities to bring vax clinics to their campuses where students can be vaccinated. I know that our numbers for our youth groups are starting to improve. I don't think they're where we want them to be, but I think they are starting to make an improvement, and the school year has started. Please, everybody's masking up. We have a couple of our districts that are mandating masks outdoors as well. Most of the rest of them are considering it a strong recommendation at this point, but we are relying heavily on those masks and on people getting vaccinated to keep our kids safe as they go back to school. So that's what I have, and any questions we can double back on later.
Thank you, Michelle.
And I have an announcement from Pam, one of our ASL interpreters.
We're good? Okay.
Okay, thank you.
Excellent. Mary Lou, let's hear from you next.
Thanks. Thanks very much, Nestor, and hi, everybody. I just wanted to remind everybody that Disability Rights Education and Defense Fund is presenting town hall question and answer sessions every Friday for an hour. The last session was a discussion with Dr. Rebecca Fielding Miller, who's the assistant professor at the UC San Diego in the Herbert Wertheim School of Public Health. All of the previous sessions are available on Vimeo, and if you're interested in signing up to attend the sessions, I'll put the link in the chat, and please feel free to look at the old videos if you're interested, and to sign up for the new sessions that are going on, will be going on regularly over the next few months. Thanks very much, Nestor.
No, thank you, Mary Lou. We have, I think, time for at least one more announcement. Maybe someone who we haven't heard from in a while. Anyone have anything to share with the group?
Hey, Nestor, I'm sorry. I got to say thank you to Mike Rubio for bringing pizza to our event this weekend. So thank you from Gabi, and I just want to say thank you.
Thank you, Mike Rubio, for the pizza. Pastor Arlene, I think I see your hand.
Yeah, my pretend hand and my real hand. Yeah. So, well, greetings from unincorporated Cherryland, where we're not too proud, but feeling the effects of being in the #1 spot for the most new cases over the last 7 days. Our CICT people are absolutely working their heads off and working overtime. We will be open tomorrow for our Comida para Cherryland. Our participation in our QAS, EFD, and our Comida are back to winter levels, and we'll be giving out backpacks tomorrow for all the families that frequent our Comida. We have 350 backpacks to share, thanks to the generosity of our members and friends, and we really appreciate that. And also appreciate LDS Church in South Hayward is also providing 150 to 200 backpacks in addition for students at Cherryland schools coming up. So that's a blessing. And we're also working hard on the URAP program. Paros Unidos de Cherryland is helping people in the community to enroll for rental assistance, and we are also processing rental assistance for Central Legal in Alameda County and so forth. So, you know, just a reminder, you just got to keep telling people are so strung out, so stressed out, afraid that they're not going to get help. And this is really hard work, but our people are working as fast as they can, as hard as they can to help process this stuff. But anything people can be doing to help make sure that the applications are as complete as possible would be a huge blessing, because we're spending an enormous amount of time helping to get the substantiating documentation together that's needed for these applications to go through. The money is there for once, you know, but the documentation, the applications have to be complete, or they're not going to get processed. So, or they're not going to get funded, I should say. I mean, yeah. Thank you.
Thank you, Pastor Arlene. If you didn't have a chance to give a little bit of an update, that's okay. We still have, I think, time for discussion later on in our meeting and on our agenda. But now I think we're going to transition over to our COVID epidemic sort of update, as well as a little bit around our COVID response and the DOOR project that folks have been working on. So first we're going to turn to, I believe, Dr. Nick Moss. Is that correct?
I think that's right. I think it's
all right.
Thanks, Nestor, and good evening, everyone. Next slide, please. Try to move through these pretty quick. I know there's a lot to talk about tonight. So first of all, just our key points in the epidemic right now. As probably everyone knows, we're in the middle of the pretty substantial summer wave here. Our daily case rate up above 20 cases per 100,000 residents per day. That translates to around 300 cases being reported every day. This is comparable to last summer, maybe even a little bit worse. and but not like what we saw in the wintertime. We now on our dashboard actually are sharing information about case rates in vaccinated and unvaccinated residents. And the number is very dynamic, but the case rate is 3 times higher right now in our unvaccinated residents compared with our vaccinated residents. Test positivity very high, up to 6% for the county overall and 9% in our zip codes and neighborhoods that have scores indicating the most disadvantage on the Healthy Places Index. Hospitalizations are one of the things that we're most concerned about now in the vaccine era, is whether or not people are ending up in the hospital. So we saw today we're up to 211 in the hospital today and about 60 in the ICU. The highest number we've been up to is 212, and that is pretty much equal to our peak last summer. In terms of the vast majority of these so far appear to be unvaccinated people. It's going to take some time for us to do a real formal analysis of that, but that is what we're seeing. That's what others have reported. And I just want to note, we'll touch more on masks later, but we looked at some data on mask use. There's a pretty well-known Facebook survey that's constantly running. Mask use increased this month from 65% on July 11th before our first mask recommendation, up to 83% on August 8th. So again, self-report through Facebook survey, but still good to know that people are masking up in the setting of this surge. Next slide, please. So here is just a visual of our reported cases by day. And this is already about a week old. You can see not quite up to what we saw in the beginning of the year. This is all 2021 data here. So the left-hand side of the slide is the beginning of the year. On the right, that's where we are now. Some pretty big days in terms of case reports, but not like the winter surge. Next slide. Next slide, please. There we go. So one thing I wanted to highlight, we highlight different things in these reports, and we look at the case rates by neighborhoods. And one thing that we've seen with this summer surge is that our highest rates have actually been in West Oakland. They were in the winter surge, we saw higher rates in East Oakland and Ashland, Cherryland, and South Hayward. And we are really seeing a slightly different pattern now. East Oakland's still higher than the county average, but West Oakland with the highest signal. Next slide, please. So we joined most other Bay Area counties. In fact, I think the holdout Napa was one of the holdouts and has joined us. So most Bay Area counties now requiring face coverings in indoor public settings, regardless of vaccination status. This is really, I think, a simple, effective tool we have to try to limit this surge. And we know it's hard to know who's vaccinated, who's not in public settings. We know that vaccinated people probably are able to pass on infection. So that's why we made this move, hoping to roll it back when this surge passes. Next slide. A couple other things relevant to vaccines. So the state issued 2 health orders at the end of last week. You may be aware of these. The first was a pretty strict requirement for healthcare workers in healthcare settings to be fully vaccinated by September 30th. So that is a pretty high standard that the state is applying. And then the state also required vaccination or testing for visitors in those settings. And then we don't have a slide on it, but on July 26th, which I think is happened since our last meeting here, the state also required vaccination or testing in other high-risk congregate settings where people live, and such as correctional settings and shelter staff. That is for workers, not for residents. Nevertheless, an additional state move supporting higher vaccine uptake. Next slide, please. And with that, I'll turn it over to Donata.
Thank you. Good evening. Next slide, please. For the COVID division, just as a reminder, we have 4 main units. We have our community testing, our community vaccination unit, our outbreak unit, as well as our case investigations and contact tracing and community support unit. Overall, for testing, our demand continues to increase, as we also, of course, see with our increase in cases. Our community testing sites countywide have seen 3 to 5 fold increase in the demand just over a couple of weeks, 2 to 3 weeks. And our percent positivity is rising in our priority neighborhoods as well. Next slide. So we are very carefully monitoring all of our testing sites to make sure that they have the capacity to meet the demand, that the testing demand. We are also making sure that we have some contingencies in place. We have some mobile testing capabilities. We can redeploy to sites in our communities where there's higher need. We also have a state resource that we can potentially deploy. It's a testing bus that can serve various locations in our county. And then, of course, if we need more resources, we can always put in a request to the state as well, in addition to the OptumServe bus that they have. And then there's other considerations. So we are closely monitoring the need for testing. Next slide. So for our case investigation and contact tracing, as you've heard from Dr. Moss, we have quite a bit of a surge in cases. So we are using a prioritization matrix, which is using 7 phases. So what that really means, right now we are in phase 4, which means that we are making 1 call to cases, and our cases are prioritized based on the vaccination rate in a zip code and also the level of the number of cases in a zip code. So we're prioritizing by those 2 factors. On Monday morning, usually we have a much higher level of cases. Some are left over from the weekend. We had 987 cases in our queue, and 326 of those were in our phase 4 queue. So of course, we always make the best attempt to reach all of those cases in our phase 4 queue. And then we also have 221 cases and contacts in our spot queue, which is our shared portal for outbreaks where workplaces and schools can report cases and contacts. Also make a lot of effort to get through all of those every day. And of course, our contacts are higher now, now that we have the Delta as a predominant variant. Next slide. And this is just an overview of all of our outbreak teams. So we have 4 teams here that are depicted here. We have a team that's focused on healthcare settings, another team that's focused on unsheltered and homeless and substance use disorder types of facilities. Then we have our CYCS, which is our children, youth, and congregate settings. And we also have a workplace outbreak team, in addition to a team specifically focused on long-term care and correctional facilities. But here you can see just in the last several weeks, kind of starting at the beginning of July, that all of our outbreak teams are seeing an increase in the number of cases that they're following. Next slide. And then this is just a quick slide showing that even our Operation Comfort referrals have increased. And I believe at this point, we're actually a little bit higher. These are a little bit, I think there's about a week out. So we have had an increase in our referrals here as well. Next slide. And then just wanted to share with everyone, we have reached a vaccination milestone. Alameda County has over 1 million residents fully vaccinated. So that's a great accomplishment, but we do have more to do. And I think the next slide is a quick video that Maria will introduce.
Yes, thank you, Donata. So we're going to queue up this video that was made by the youth at Fremont High School in Oakland. And Fremont High School, as many of you may recall, was one of our stationary community pod sites or community vaccine sites. And this video was produced by the Alameda County Office of Education. So are you able to hear the audio?
I'm not able to hear Maria.
Okay, I just had to pause it. I'm going to put others on mute. If other people could please mute themselves. Okay, let's see if this works. Thank you.
No audio.
We're not getting any audio, Maria.
Okay, well, let's see if we can bring it back later. So apologies for that technical difficulty. But we will go back to our slideshow presentation and try to bring you this video at a later time. Donata?
All right, thank you, Maria. So this is from our dashboard, and I'm not going to go through all of this. You can access this every day. It's updated, but our 12-year and over population has at least one dose. We're at 85.9%, and that's on the left there, on the left top corner. And for those that are fully vaccinated, 12 years and older, we're at 72.5%. I do want to show you in the middle there, the top middle graph where you have the blue and the yellow line. The blue line shows that there's the 12 and older that have at least one dose. And then the yellow line is those that are 12 and over that are fully vaccinated. And we're hoping to close that gap, of course, between the fully vaccinated and one dose. We want everyone to get their second dose. But then we also want to see both of those lines going closer to the 100%. And then you can see there the third box on the bottom, the doses by age group. At least one dose, again, is the blue line, and fully vaccinated is the yellow line. And you can see for the 12 to 15, for fully vaccinated, we're at 55.8%. And then 16 to 34, 64.5% fully vaccinated. So you can see those trends there. Our highest age group that's fully vaccinated is a 75 and over, which is at 81.4%. And then you can see the next box on your right, the doses by race, ethnicity. You can see again the blue and the yellow line for fully vaccinated, that we still have some work to do here with the Hispanic Latino group, as well as our African American population. And then on the very right, you can see which cities and where they are in terms of their percentage fully vaccinated and at least one dose. And again, this is on our dashboard, and you can take a look at that anytime. Next slide.
Donata, there appears to be a hand from Kevin Dowling. I want to see if that's a direct question about one of the slides. And if not, we can hold it to maybe the end of your presentation.
Well, you can hold it to the end, Nestor.
Okay, thanks, Kevin.
All right, and then this is a graph of youth 12 to 17 vaccination rates. So this is a percentage, at least one dose overall by race and ethnicity. And again, our population of 12 to 17 is about 80,000. And you can see here again on the right that our African American Black is 31% vaccinated, and then 48% for Pacific Islander and 50% for Hispanic Latino. So the estimation of youth unvaccinated is there at the bottom. So approximately 38,000 in total that we still need to vaccinate. Next slide. Oh, and I wanted to just make sure that I know at the end we'll have some time for discussion, but we really want to hear from you. What are the youth vaccination concerns and barriers that you're hearing? Because we want to make sure our messaging is appropriate and reaches those 12 to 17. And what success stories or strategies can you share with us? So we'll have some time at the end for that. Next slide. And then this is again looking at just the youth between 12 and 17, rates by city and place. And then you can see here from left to right, we're at, for all of Alameda County, 69%. And then Hayward Acres, Ashland, Newark is at the lower end with 48, 50%. And then you can see at the 100% mark, Piedmont, Albany, and Berkeley. So this gives you a sense of where we are with regard to our cities. Again, here you can see the estimates on a graph, on a map, with Oakland, approximately 10,000 doses that we still need to administer. Again, the darker color is the unvaccinated population, and the lighter color means that there's fewer unvaccinated. Next slide. And then this is some of the school vaccination sites and events that we've had in July and August. So the little green dots represent sites that we have had. And you can see there is a concentration in the Oakland area where we have the highest unvaccinated rates. I mean, you can see on the left there some of the sites that we've served. But it is important to get the messaging out so the youth actually come to these sites for the vaccine. Next slide. And then again, this is again 12 to 17 vaccination rates by census tract. And again, you can see the darker color is less than 50% vaccinated. So some of Oakland, and then you can see some in Newark and their Union City areas. So we also have a little spot in Livermore, so you can get a sense of where our unvaccinated 12 to 17-year-olds are. And I just want to let you know that we do have an interest form available. There's a link here on the right. So if you know of a school or a youth organization that would like to do a pop-up mobile vaccination event, we are happy to partner with you on getting that site set up. Next slide. All right. And then I think the next slide was for Lisa to present. There's 3 slides on schools.
Yes, thank you, Donata. And I'm going to try to play the video again. So if you could please bear with me here. I think I got it. Thank you all for your technical assistance.
I would really encourage you to get the vaccination for your family's sake, for our community's sake.
I know side effects are a big thing. That personally did not stop me. I'd rather get that and save thousands of people's lives.
I would say think about the community, think about those closest to you that are most at risk, elders, and just do it for yourselves, just so you don't have to worry about it.
I can do so much more things. I could go to Target. I mean, I know we all love going to Target.
I was really nervous about just going out and eating, but now I feel more comfortable and I can relax.
Only takes a couple of seconds, so just get it done, get it out the way, and we can go back to living our lives again.
Now that I'm vaccinated, I feel a lot more safer. The vaccine isn't preventing COVID, but it is an extra layer. But the vaccine does boost your confidence on going out and doing more stuff.
And we can build a strong Fremont community again, and not just for Fremont, for everybody around us as well.
Thank you all, and a shout out to the high school youth from Fremont High School in Oakland, and also to the Alameda County Office of Education who helped produce this video.
Thank you. I think we're gonna hear from, was it Lisa who was up next, or what I have on my agenda, Mike, but I wanna make sure I have the right person.
Yes, thank you, Nestor, and apologies for that. That's Lisa Erickson, our schools liaison. Lisa, would you like to introduce yourself, please?
Hi, everybody. I'm Lisa. I think I've met most of you on this call. I work at the Center for Healthy Schools and Communities, and I've been helping schools, childcare, basically all child and youth settings since the beginning of the pandemic, just helping and supporting them with understanding the guidance and just opening their businesses and programs safely. So thanks for having me. I'm just going to do a real quick overview of what schools are working on as far as guidance. Oakland opened this week, and Many schools are going to be opening over the next few days and into next week. So it's been a very busy week, to put it mildly. So this is just, again, a high level summary, but this is everything that's included in the state guidance. The first strategy is Cobit Vaccines. This is one of the most important strategies and safety measures for opening schools, especially obviously for secondary and high schools. The vaccine won't be available for elementary schools yet, which is why masks are so important. So masks are required indoors for all children and youth settings. And we're now strongly recommending that they're also worn outdoors, as we are in high transmission. And the CDC does recommend that unvaccinated people wear masks outdoors when there's high transmission in places where you aren't able to distance. And as we all know, recess and being outside with kids sometimes, some of those activities are, there isn't a lot of distancing happening. So some districts are actually requiring masks. And next is ventilation, just good airflow in classrooms, opening windows, upgrading the ventilation systems, and regular hand washing, which I think we all know already by this point. We all know a lot about hand washing. Next slide, please. And this is also a very important safety measure, just trying to do a lot of parent education and information around, really ensuring that children and staff stay home when they're sick. Last year, there were very stringent health screening processes in place. This year, it's not quite the same process, but still lots of education and lots of information around what the COVID symptoms are for families and what it means to stay home, how long they should stay home, getting tested, when there are symptoms. All of that is a very important part of school reopening. Testing is also important. The state has a very robust testing program. I believe they've gotten about $1 billion actually from the federal government to work on school testing. So we've been actively encouraging our districts to reach out to the state and set up these testing programs. I'm actually going to let Michelle chime in a little bit too around testing in a minute. Michelle from ACOE here. And vaccines. And contact tracing is the last, case investigation and contact tracing. We've been doing a lot of training actually since the beginning of the pandemic around how to do contact tracing. What does close contacts look like? We have very clear protocols and materials that we're developing even more and actually we're doing a training this Friday for all of our COVID liaisons at all of our school districts. So every school and district in the county has COVID liaisons, which are people that actually work on understanding all of this COVID guidance and doing the contact tracing. So we'll be working with them. We work with them pretty much every week, but we'll be doing a training for them this Friday. Michelle, do you want to chime in a little bit about testing or anything else about the guidance before I go on to the next slide?
Sure. So I just wanted to share that we have a couple of designated folks at ACOE that are working, Ruth Jones, and then also our COVID coordinator, Robin Malfatti, who are communicating directly with districts who are ramping up their testing. What we have done is prepared sort of guidebooks on how to ramp up a testing program, how many people you need, what roles they need to play. As you know, the reality is that the funding is certainly there and we are super appreciative of that and the tests are available. But what the districts need at this point is to know how to deploy their staff and how many people that they need to assign and how many people it's going to take to run a testing program. And in the process of getting ramped up for school, which usually takes all hands on deck for school districts, where they're being asked to do multiple other functions related to COVID. And it's really a people issue at this point. How many people, how many resources do they have to bring to bear to this? And so we're really working closely with districts to get them ramped up on how to run a testing program and all of the various roles. In addition, we are continuing to connect folks, as I said earlier, with vaccine opportunities. We have been, Lisa and I will tell you for the last month, we have been, I won't say harping, but sure, we've been harping on the districts to get that interest form turned in and get those vaccine sites at their school sites, which also requires some people investment from them and a little bit of time. So again, we're really working with the districts to try and get them most efficiently to put their resources in the right place to run a bunch of things that they aren't used to having to run. while ramping up for school. So that's the reality on the ground, but we are really working hard to try and help folks figure out how to deploy their resources.
Thanks, Michelle. Next slide, please. I'm going to ask you to chime in on this one too, Michelle. But I included this slide. This isn't really, kind of public health slide, but I think it's important. And we do get lots of questions around this. So I wanted to inform everyone just around the policies around, virtual learning versus in person and kind of how all this came to bear. And ACOE is definitely the expert around this. So Michelle, I'm going to let you talk a little bit about this legislation.
Yeah, absolutely. So the legislature passed Senate Bill 130, and it was part of the budget process. And what we all need to understand is that we were dealing with a lot of hybrid models last year, and the phrase distance learning. The legislature and the governor's office felt strongly that they wanted students back in classrooms, and they wanted to provide an option for families that opted not to have their children return, and they did it via independent study. So independent study, you may recognize if you've gone on a long vacation or you've had a student or know a student that spent a significant amount of time out of school. We're used to seeing independent study quite a lot for, I will say, folks that do sort of outside activities such as, sports like figure skating and things where the kids have been pulled out of school for a long period of time. But what the legislature asked schools to do was beef up the independent study process and make it available to families who opt not to have their children return. But schools do not have a pathway this year for hybrid education. For this year only, independent study is the alternative for families. There are lots of rules around this and families can move very quickly from independent study back to the classroom and back again if they want to. There are a lot of requirements around the amount of time that they're going to be spending in front of a teacher. But I just wanted to sort of clarify, because we're hearing a lot of information about parents that are interested once again in this hybrid model, and just understanding that the state did not provide a pathway to hybrid education for our schools. So you have two choices as a family: is in-person instruction or to enter independent study, but you are free to come in and out of independent study if that's what you prefer. So I wanted to set that straight, because I know hybrid was a word that was a bad word last year, but seems to be making a comeback as we move into this Delta period. But it is not an option for our public schools to offer hybrid education. So I wanted to offer that as clarity.
Thank you, Michelle. Next slide. I think that was our schools update.
Hi, I'm sorry. I have a question on the school update. Can I ask now, or would you prefer I wait?
No, you should ask now.
Okay, great. So I understand that it seems like there's some fluidity between independent school and in-person school. So if a child tests positive or has coronavirus and needs to quarantine, what is that process like for the family? I've heard that the child must disenroll from in-person and then have to quarantine and then need to re-enroll. Can you clarify that?
Yeah, I mean, I'm not sure disenroll and re-enroll are necessarily the words I would use, although maybe effectively that's what's happening.
Okay.
They're going to be moved into independent study during their quarantine period to make sure that they're maintaining their opportunity to get lessons and get the information every day. And then they will have the option when their quarantine period comes over to come back. So but they are going to be moved especially if the quarantine period's long. So what we've discussed is, for example, if you are not sure that a child's got a diagnosis and they're out for a few days, that isn't going to trip them into the independent study model. But if you've got a 10 to 14 day quarantine, then that will likely put them in independent study, and then they will go back into their classroom once they are cleared to return to school.
And I would just add that I don't know if a lot of you all know, and this is a lot of detail, but there are a lot of different quarantine options now, where you can have a modified quarantine, which allows kids to come back to school after they've been exposed. We won't go into all those details, but the state provided more options just so that we can have kids be more kids back in person as much as possible.
Okay, great. And that process of moving to independent study and back into in-person, is that a burdensome process for paperwork for the families, or is that pretty easy, no paperwork involved?
I don't know the answer to that, Dr. Carey.
These are just the questions I'm hearing from the community. Lots of parents are sort of freaking out that they have to complete lots of paperwork to move their child from in-person to independent and then complete additional paperwork to bring them back into in-person. So just trying to get some clarity.
I don't know. I haven't had at the county office, I haven't had literal experience with that process. As with anything at school, I imagine there's paperwork involved, but I will actually try and find out that information, because I think that's one of the things that we put together a one-pager for families on independent study to share with them the process. But those are the on-the-ground questions that I agree that people really want the answers to. And, you know, I know Joan said enroll and disenroll are the words I would use, but they're not losing their spot in the school system. They are moving to a different area of education. And again, I will share that districts don't have a lot of choice about how they're administering these programs. And the emergence of the Delta, I think that when the state said these are going to be our two options, we weren't dealing with the Delta variant. And all of a sudden, I think there's been a lot of parents who have concerns who are moving quickly toward the independent study option. And school districts are frankly scrambling to staff the independent study classes because they aren't staffed up the way they thought they were going to need to be in June compared to where we are now. So I'm sorry, Joan, I'm just reading along, but anyway, but I'm going to get more information about that, because I think as a school district communicator, it's important that parents have a good idea of what the process is. I can't promise that it's not onerous, but this is the only pathway that school districts have been given, and they are adjusting quickly on the fly.
Great, thank you.
Before we move on to hearing from Deputy Director George Ayala, I do want to make sure that we get to Kevin's question, because I know that you had a question, Kevin. You can go ahead and ask.
Thanks, Nestor. LA County and San Francisco County have both required their employees to be vaccinated. Is that something Alameda County is considering? And I would hope that they are.
Go
ahead,
I can start. I mean, so that, that's really a determination made by the county administration and human resources. Those are not, that's not a health officer action, and was not a health officer action in those jurisdictions. So, we would, I think, really defer to those entities for that.
Thank you, Dr. Moss. There might be a couple more questions, but we still have time for a little bit of discussion right after we hear about the door project. And I believe this is Deputy Director Ayala, is that correct?
Actually, Nestor, we're going to go back to Donata for the last two slides.
We're going back to Donata,
vaccine,
sorry.
so we could close that section, and then we're going to move into the door program.
Okay, thank you, Maria. So these slides will be available after tonight, but this just gives you an overview of what entities in our county have provided vaccinations. So you can see our healthcare system partners and large pharmacies, Coliseum, et cetera. So take a look at that. And then the last slide is just from our website where all of
Did we lose Donata?
I think we lost her, but I'll fill in. So here is our schedule of our vaccine sites, but also the vaccine sites of our partners. And it is updated regularly in multiple languages. You can download it as a form. So please go to our website. I will also share it in our chat. So thank you, Donata. Thank you, Dr. Moss. Thank you, Lisa. Thank you, Michelle. And now we're going to hand it off to Mike Rubio to give a presentation on the direct outreach to our residents, our door program.
And Donata apologizes, she lost power. So
thank you, Kimmy.
All right.
Well, I hope the power stays on for at least the next couple of minutes. I'll move quickly. Hey everybody, how you doing? Michael Rubio with the Public Health Department. So I just want to share with folks what's going on with the DOOR program. And so DOOR is direct outreach to our residents, and it's an outreach strategy where its primary modality is door-to-door outreach. Basically, we're sort of taking this really ambitious, undertaking of trying to have 90,000 conversations or attempts over the next, I guess we have about 5 weeks to go. It's an eight-week program. So we've started on July 7th, and the idea is to identify the 23, or we identified the census tracts with the lowest vaccination rates and highest need for Black and Brown. So it's a combination of organizations from our community navigator groups and our outreach and health education groups that have come together to do the outreach. Next slide, please. So this slide, you'll see the census tract that were identified. And these are the census tracts with the lowest vaccination rates. So the percentage of people that are vaccinated, as well as the highest numbers of unvaccinated. We don't want to go with just percentages. We also want to focus on the areas that have really high numbers of unvaccinated folks. So you'll see the high level overview of the census tracts there and where we're deploying the work. We've already had a lot of organizations that are doing work in zip codes. And what census tracts allows us to do is just really, really zero in and target the specific neighborhoods that are in the most need, or the highest need. Next slide, please. So here's a picture of our good buddy, Andy Nelson, who I'm channeling today, who was really the catalyst for this program. And the top is a quote from Andy that actually should be in quotes. It says, "Moving at the speed of trust." And so with that, that talking about is, this is a neighbor to neighbor strategy. This is about folks from the community having conversations and engaging in discourse and dialogue with other people from their same community. So it's really about making sure, and folks that you know and you see and you trust, right? Trusted messengers. So again, the goal is to really have about 90,000 conversations. To date, actually, I looked at the latest numbers earlier. The numbers have been coming in from the partners. We're at 14,382 door knocking, right? So within we're starting week 4 now, and week 1 was really a pilot week. So we're moving along there. Can you go back one more slide? I just want to say the door knocking is just one of the different modalities that we use, right? So door knocking is definitely the primary one, but we're also flooding commercial corridors, doing outreach in commercial corridors, doing a lot of outreach surrounding mobile vaccine clinics and pop-up events. And then also having the partner organizations host clinics and also have events. So you've heard folks earlier talk about backpack giveaways or food distribution, things like that. And really just saturating those census tracts with effort. Okay, next slide. And then we're making sure folks are protected, right? So they get their outreach kits. The outreach kits have PPE, hand sanitizer, masks, face shields. We have some really cool green t-shirts. So if you see folks out there in the t-shirts, make sure and give them a honk and a wave and a thumbs up, something like that. And then, this is us just staging things in the office and getting outreach kits prepared. And we make sure folks have flyers. They have the door hangers and the information they need. And it's not just information about COVID vaccine, right? When we're having conversations with folks, we're having conversations about all types of different resources that are available to them. Because, COVID is one thing that our folks struggle with, but there's many other things that, as a result of the pandemic, folks are dealing with, right? So it's rental assistance information, all that kind of stuff. And that can be found on this link tree. I'll make sure I put the link in the chat. So all of the flyers, we try to make them hyper local and specific to the particular area that the door knockers are at. And so if they're in the San Leandro Hayward area, there's information about all the various clinics there. If they're in Oakland, Tri-Valley, Tri-City, wherever they're at. We use for the physical material, we have the static pods that are available. And then on the link, we have links to all of the various pods from partners from other county, mobile vaccination clinics to all our CBO friends. And so, the link tree is something that also has, like I said, a lot of information around, rental resources, other types of information that folks need and are looking for. Next one, please. I think that's it. I'll put the link in the chat and feel free to ask any questions I've answered.
Thank you, Mike. And now we will turn to Deputy Director, Dr. George Ayala.
Thank you, Nestor. I'm meant to give an update on the Community Coalition's RFP, and unfortunately, I am unable to say much more than what I'm going to say now because we have not officially issued award letters as of yet. But I can tell you that we received 9 bids in each of the categories. I think you know that there were 2 main categories in the RFP. One was for coalitions, and the other one was for single organizations interested in providing community engagement services, which to us includes outreach, health promotion, education, and social marketing. And so Director Watkins Tart and I, along with the Director of the Healthcare Services Administration, have been in communications with one another. We received the recommendations from the County Selection Committee late last week, and we just sent back our recommendations for awards. And until those award letters actually get received or are in the hands of the recipients, we cannot make that information public. I am, though, going to say that the proposals were quite strong, and we're very, very excited about what we're about to do. We, as you know, took a very different approach in this RFP, and the coalitions aspect of the RFP was particularly interesting from our perspective. It called for proposals to help support our vaccination efforts in hyperlocal ways at the level of census tract, really. And it also kind of gave a nod forward and invited coalitions to think creatively about post-COVID work and to propose ways to lay down foundations to some of the kind of resilience building work that we all know we need. So we're very, very excited about that. It's also unique in that, we're continuing to support a focus on health promotion and prevention. So I'll leave it at that. I think at the next CAG meeting, we'll have a lot more to talk about and to say. So thank you, Nestor, and thank you.
Thank you, Deputy Director Dr. Ayala. I think now we will open up the space for any additional questions that you all may have, as well as feedback, sort of recalling that question we had earlier in Donata's presentation, specifically around youth, but as well as any feedback on just how we as a sort of as a group can improve our work, but also as a county can improve our work, and how we're ensuring that we are doing what needs to be done. So either questions or feedback is welcome. So I'm opening the space now. We have at least 15 minutes for, if not a little bit more, for questions or comments and feedback.
I had a question going back to the slide about the percentages of youth vaccinated, and it had the racial breakdown, but it said overall, it seemed like it was 80%, but then if you look at the breakdown, it didn't seem like it added up to me. I don't know if we could possibly go back and take a look at that again.
Thank you, Dr. Cook. Maria, can we pull up that slide? Is it possible? Thank you.
It might just be me, but I was just looking at the numbers. It was the one prior to this one. Okay, yeah, 20. I guess I don't have the total numbers. So it seems like 69% seems rather high when you only have two categories, Asian and Native American, higher than higher than 69%. And you've got the other categories much lower. I'm just trying to figure out how it could, but I guess we don't have numbers of individuals in here.
So the way that I interpret this graph is that the total is overall, we have 69% of youth, 12 to 17, that have had at least one dose. But then within the Asian group of 12 to 17, 80% of Asian group have had at least one dose, and 80% of Native American, and so on. That's how I see this data. And then the bottom numbers are the total number of approximate numbers of unvaccinated. Does that help?
Donata, this is Ralph. If I can help, I think it's because there's so many vaccination reports that are missing ethnicity. So the 69% is everybody, even people for whom we don't have race ethnicity. But the race ethnicity data is only for people where it's reported. So you see the same pattern when you look at vaccination rates for the overall population. The overall population is more vaccinated than the race ethnic groups, because unfortunately we have so many vaccination reports that are missing race ethnicity.
Okay, thank you. That makes sense, because if you took Asians and Native Americans, they couldn't make up a significant enough number to outweigh all the rest.
Right.
Okay.
The sad thing is, after all these years, we still have not gotten to where we should be in terms of reporting race ethnicity on public health data, unfortunately.
Okay, thank you.
All right, thank you. I see Keith Brown. Brother Brown, you're up.
Yes, thank you. This was an excellent report, and I know in the update it presented information about the availability of testing at the school site. My question is around, has there been any discussion with the county agencies around, regarding weekly testing available for students and staff at the school sites as an additional mitigation strategy? And I know that earlier today there was a webinar from the State Department of Education where the state board president, Linda Darling-Hammond, talked about the importance of testing, and then she did note that they weren't seeing a spread of the COVID transmission at schools, but concerns about with the Delta variant being brought to the school site. So just, wondering about like the availability of weekly testing.
Dr. Moss, did you want to, or someone from ACOE?
I can take first crack, and then others can join in. So, good question, and one I know that we've heard. It's going to vary by district. There are options that have been laid out. The state has laid out for different testing strategies. From our standpoint, the single most important thing we absolutely want to make sure happen is that people who are symptomatic or people who are exposed to known infections get tested. And then there's a range of different strategies that districts can use and schools can use and they really need to find the thing that works best for their community, their students, their staff. And so we are continuing to work with ACOE and work with districts across the county. I know the state has put a lot of resources into testing for schools. And so there are options and resources available to support this.
Thank you.
Did that cover the question, or did we want to hear from COE as well?
I mean, let me pop back in here. We're fielding calls from districts who want testing, who are asking how to set up testing programs. The cadence is varying based on what the district's needs are. I understand that, I understand weekly surveillance testing would be a great mitigation measure. All I can speak to is each district knowing its capacity to be able to pull off the infrastructure for a program like that when there isn't, when there may not be the staff support. I don't think that the accessibility of the tests is an issue. The state is obviously making those tests available. But we're working with districts, but we're not mandating anything at this point in terms of testing. I'm not sure if that's the ask, but we're not mandating a cadence for testing. We're going with what public health is recommending in terms of a testing cadence and what the state is recommending. And then what we're doing is just trying to facilitate with the districts, getting their testing up and running and how to maximize the resources they have to run those programs.
Thank you. I appreciate that, and I know it's speaking for Oakland. It's a concern coming from the community, parents, and educators around having weekly testing that's happening at the school sites. But I appreciate the answers.
Thank you. I will now let's see. I see Miss Sherry's hand is up.
Good evening, Miss Sherry. I have a couple of questions. I wonder, are we talking about considering more mobile sites in the community or vans where we could possibly announce a couple of days in advance the van being parked in different areas, especially in Black and Brown communities, with the option of folks coming out and we meeting people where they are and being vaccinated. And also, I'd like to know a little more about what's happening with the county jails. Do we have any information there? And is there any high probability of the Delta variant translating to the population?
So I think that to start with the first question about community-based vaccinations, our mobile vaccination effort, most of our vaccination effort actually is mobile or pop-up. And so it's done in partnership with community-based organizations. And so there is outreach that's done prior to the day of the event. And actually we have members of the CAG on here now who participate actively in this and can probably explain kind of how they get the word out before the day of the vaccine. And so, yes, Ms. Sherry, we absolutely do have vaccination efforts going on all over the place where people can come out. They don't have to make an appointment. It's if they see the van there, but we still want to make sure that people know that a vaccine pod is going to be in their neighborhood. And so I would, defer to La Familia and Street Level and others to maybe speak to Ms. Sherry's question around how exactly people know about it, because, you can put it there, but how do people know to come?
I can share a little bit. So for our team, our strategy really has been, it's a week-long process. So basically we start 1 week before our vaccination clinic. Usually our clinics are on the weekend, Saturday and Sunday. So we'll start the Saturday before of doing either door knocking at residential homes, going out into the neighborhood where the clinic is going to happen, going to the different businesses and dropping off flyers, and we have shifts. So we have morning and afternoon shifts every single day. And so with this, we're also providing PPE, so masks, hand sanitizer, other information and resources. And so it really does take a whole week of outreaching to be able to be successful. And then part of the day of, we're actually sending a small team of outreach workers, which are community members that are part of our organization, to go back into the neighborhood and flyer while the event is going on, and also all of us in the area also talking to people as they're walking by.
The second part of your question, Ms. Sherry, was related to Santa Rita. So we have been working with Santa Rita Jail, and actually we have a team, a correctional facilities team as part of our specialty populations and outbreaks team. And we work with them to provide guidance, recommendations, mandates around testing, quarantining, cohorting, the whole 9 yards. And so it's one team of people in our public health department that have been working with Santa Rita the entire time. So we have stayed with them the whole time. And so, yes, I mean, I think I defer to Dr. Moss to speak about the amount of Delta variant, circulating, but I believe that, yeah, more likely than not, it is represented in any transmission that's happening anywhere in the community at this point. But Dr. Moss, do you want to speak specifically to her question about do we think that the Delta variant is presenting in Santa Rita? I don't want to.
Yeah, I think Director Watkins-Tart, you're right on the nose there. Any virus that we see in any setting in Alameda County right now is likely to be Delta. And so that would apply to Santa Rita as well. I think those prevention strategies that Director Watkins-Tart mentioned continue to be really important in Santa Rita. And I think this is a big test. We have seen cases there before. I know there's some, they report out cases every day on their website. I know there's some cases that have been reported mainly among staff. So there's certainly a need for ongoing prevention measures in place in that setting, and certainly the ability of Delta to be transmitted is important. And I'm sorry if you mentioned this, Kimmy, but the state has recently set a pretty high standard around testing and vaccination for corrections staff with a health order that came from the state health officer on July 26th. So that will certainly help.
Can you restate what that is just for everyone so that everyone knows?
Sure. It basically for any staff who can't show evidence of vaccination, they have to be tested weekly in those settings. So it's directed at staff. We had something similar in place already for Santa Rita. This is actually a little more frequent and includes more people. So it's and it hopefully will promote high vaccination rates among staff as well.
In addition to this, when the vaccine became available in December and January, at the first possible opportunity, we were very aggressive, I would say, in making sure that we could offer vaccine to everyone at Santa Rita, both people who are incarcerated as well as the people who work there. Because it was our goal to ensure the maximum amount of protection. Now, of course, the vaccine is not mandated for anyone, not for staff and not for the people who are incarcerated. They choose if they want to be vaccinated or not. And we continue to provide WellPath, which is the clinical partner at Santa Rita, with any information, materials, videos that we find that they can use to provide education and information to people who are incarcerated there, to help encourage them and help provide information. We also did a survey there. The public health department did a survey amongst the people who are incarcerated as to their attitudes and beliefs around vaccination and why they would or would not be tested. And so, because we offer a lot of, or not we directly, but WellPath provides a lot of testing at Santa Rita, both testing in open areas and testing when there's a positive. And so there's a lot of testing that goes on. And sometimes people who are incarcerated, they will say no to the testing. And so we wanted to better understand what was getting in the way of that. So we have done a survey around that. And so if you wanted to see that, we could send that out to see the results of the survey. It was a small sample. Not a lot of people really wanted to participate in the survey, but we had it in different languages. We had it so that they could talk to us directly in the public health department if they didn't want to write anything down. So they'd be confidential. But yeah, we can share that with you.
Thank you.
Thank you for those very important questions, Ms. Sherry, and thank you to those who answered. I think we have time maybe for one last question or comment. If you haven't had a chance to ask and you have a burning question or you have a piece of feedback that you'd like or comment you'd like to share with us, please, this is your chance, last chance, I would say.
Nestor, while people think of their last question, we do have some important announcements. So it's unfortunately wildfire season, and we have some great information on our social media about signing up for air quality information. So please check us out at our social media presence on Facebook, Twitter, Instagram, and our YouTube channel. We're at Dare to Be Well, the letter B. And let's see, our next Community Advisory Board meeting will be on Tuesday, September 14th. That's the second Tuesday of the month at 5:30. We have a link to all of our information, including slides, past slides, and recordings. And then there's also a bi-weekly COVID update that you can sign up for, and then get updates about the vaccine. Find testing sites. We've been sharing links with you, so we invite you to continue going to our site, share it with your friends, share it with your neighbors, and we hope to see you at our next meeting. Any last question, Nestor, before you wrap us up here?
Just one last question. There seems to be a question from our attendees regarding the masks, the N95 masks. Anyone want to take a shot at that question? I'm trying to find it here in the chat. Encourage folks to always to look at the chat. I believe it was a question around the best kinds of masks to use with this variant. Anyone want to answer that quickly for our attendee and maybe some folks here on our panel who may have a similar question? I believe it's around which recommendations around which type of mask to use.
So the I'll give you some general principles in terms of just the masks. The surgical masks that are disposable are still, good masks to wear. N95 masks are recommended for people in certain settings, in certain occupations. It's not something that we are, saying that everyone in the general community would need to wear. The key to the mask wearing is properly wearing it. And so whatever mask you're wearing, even if it's a cloth mask, but making sure that it's a, good cloth, and that there's not, a lot of air that passes through the cloth, but that you can still breathe. Covering the nose and covering the mouth is the key, and that it has a good fit. Whatever mask you're using, as many of you know, we see a lot of folks out there, and the mask is kind of hanging off, and so then it's not so effective, no matter what kind it is. Thank you, Need for that additional information.
All right, excellent. Thank you. if there are additional questions about mask wearing or about how to access the right type of mask, I'm sure our staff and folks here on the call are more than happy to continue answering any of those questions or pointing you towards resources that are available to folks. I think for the sake of time, we're going to wrap it up and we're going to close out. And just as a reminder, our next meeting is September 14th at the same time. I thank you all for being here and for, again, taking the time out of your evening to share with us. Thank you to our ASL interpreters, as well as our Spanish interpreters that always make this space as accessible as possible, for helping us make this space as accessible as possible. I know that we still have some work to do, but that we are trying to improve every meeting if we can. So thank you all for your time and for sharing with us this evening. I hope to see many of you all soon.
Thank you, Nestor.
Everyone. Have a good night.
Thank you. Have a good night, everyone.
Thank you, everybody. Good
Thank you
night.
very much.
Good night.